welcome to my upper blepharoplasty vlog. As you can see, I already got it done, but I forgot to film an intro to this video. So I wanted to explain what my eyes look like beforehand and why I ended up going with this surgery. I think most people can agree that I didn't really need surgery. However, it bugged me the way that my eyelids were uneven from one eye to the other. It also bugged me that one eye was way more hooded, and basically the skin would just fold over way more on one eye, and it just looked really, really lopsided. The overall effect that it had was that I looked tired, I didn't look focused, and I finally decided to pull the trigger on this surgery because I wanted to look more awake, rested, and alert. In this vlog, I'm going to take you through the recovery period because I watched tons of these videos before I got my surgery and I found it really helpful. The one thing about my surgery that's different is that I bruise and I take a long time to heal. And a lot of the videos I saw, they healed really quickly and they looked good at just week 1. And so as a contrast, I wanted to show my recovery process because I knew that I was gonna look busted for a while. And that way, if you're interested in this procedure, then you know what to expect. So I bought these Arnica tablets. It's supposed to help me like heal after I get my surgery. Treatment plan is for $6,700. $6,700. I already made a $2,000 deposit.
In the front. Okay, thanks.
That's how much fat needs to be cut off. Or skin, or whatever.
For when we flip, so it'll be a little.
Okay, let's go.
Wow, you look great.
Thanks.
Good job. Okay.
Are you being sarcastic?
No, you look great.
Okay.
You ready to go? Okay.
All right. No, he'll sign, but I'll give you a copy of this. So Tylenol.
This is the night of. It's a little bit swollen, as you can see. I just need to ice it. I'm not drinking. I think I'm gonna bruise a little bit, but hopefully if I keep up with the icing and just like relax the eyes, then I will heal quickly. But so far, I think this is pretty good. I mean, I know it's really hard to tell, but like, I think it made a difference, like, to me. I know a lot of people don't know why I did this. I'm trying to ice as much as possible. They said, do that as much as possible. I know this is gonna take me a while to heal. Now that I've seen everything, like I'm clearly, my eyes are purple. I've seen some videos of people healing and they just look like they have like swollen eyes, but it's not purple. You know what I mean? Like I'm purple. I tend to bruise very easily. Like if I get a mosquito bite on my leg, it'll be bruised for like the next 2 years. This area is the most bruised on that eye. And then this area is most bruised on this eye. So day 2 of my upper bleph.
2, ready?
Swollen, but not too bad. Well, I mean, depends who you ask. I think tomorrow might be another bad day, but then after that, I'm expecting it to go down a little bit and start looking a little bit better. See you tomorrow. Hello everyone, I am going to work. It is 7:20 in the morning. I put on a little bit of makeup, but I did not put any makeup around my eyes because I can't for like at least 2 weeks. I don't want this thing to get infected, so I am going to work looking like this. I know. But I did warn the patient that I look like a frog, and it is what it is. 1 week. Actually, yesterday was the 1 week date. I got my surgery done on Friday, and then yesterday was Friday, so that was 1 week. But today is 1 week and a day. And we're coming along. Slow healing, but it will heal. Can't rush these things. Can't be impatient. The body needs time to do its thing. My body's going through a lot right now, okay? Was it a good idea to do all of these things at the same time? Maybe not. Maybe not. But it is what it is. Good morning. It's about a week and 2 days since I had my upper blepharoplasty. It's looking a lot better. Like before it was super, super purple, but see that the rest of it's starting to dissipate, but this little bruise is like really going strong. This eye is more swollen than this eye. This eye is the one that she took away a lot more skin to even things out. I thought that this one was going to swell more because in the beginning it was starting to swell a little bit more, which is why I have like that. And so I iced this one even more than this one, but that was a mistake because I should have iced them both like evenly. It just goes to show icing a lot in the beginning does help. I was icing it, it just wasn't icing it as much as this side because I thought that this side we didn't do as much. I'm gonna put this little red light mask on. I'm using the current body and I'm just gonna like slide it up my face so that it's over my eyes. So like this is the nose, it's supposed to go here, but like I'm covering my eyes because there's a slot for the eyes and I want my eyes to be part of the whole situation. Oh, it's very bright. Okay. I am here at my post-op appointment, just dashed out of work to do this. Hello, I'm back home and I realized I forgot to show you guys what my eyelids look like. Yeah. It's so nice having the sutures removed. So I'm not going to do anything really for the next 10 days. Then I have a scar gel that I purchased for like $50 something there, but I heard it's a really good gel and you put it on your eyelids after 10 days. I know I looked crazy for a while, okay? And I know like some of you guys think I still look crazy, but I see the vision. I see the vision. This is day 16, so it's healing pretty well. I think now it's starting to look a little bit acceptable. Like I could go out and people aren't staring at me like, what happened to your eyes? People have told me that this little thing looks like eyeshadow, like I'm full glam all the time. So I get to start putting on eyeshadow in a week. On Friday, that's when I get to start putting on eyeshadow. Today is Sunday, so I have about 5 days before I can put on eyeshadow or anything on my actual lids to cover this sort of thing up. What you need to buy to prepare for this, don't be like me and wait till afterwards. Buy one of these mask things from Amazon and then just sit with it on your eyes, like, so you don't have to hold anything. Because I was like holding an ice pack to each eye and I favored this eye. And then this one got messed up looking in the meantime. And then later on, once this formed, I was like going even, but once it forms, it's too late. So just get a whole bunch of these. You only need 2 and then alternate between them. Really let it sit there. I think the first night, the next day after that is when you really, really, really want to be icing all the time. And that's going to shorten your period of recovery. Also, no alcohol. Don't drink alcohol. It takes a lot longer to recover if you drink alcohol. I didn't drink alcohol and this is how long it's taking still. Also, you want to pick up bromelain and arnica. I actually picked up one of these boxes and I figured it would be enough, but I ran out. You need more than what's in here. This is a 5-day blister pack with 30 sublingual tablets. So I would definitely get like at least 3 weeks worth of arnica. So this is the least you could do to try to like speed things up. And then the last thing that I did, I don't have right now in front of me, but it's that ice wand, the TheraBreath depuffing wand. That one's clutch. I just leave it in my purse for on the go because it's so hard to bring ice packs around while you're on the go. And ice all the time. Like while I'm sitting in the car, while I'm a passenger princess, then I would just ice all the time. Those are my recommendations if you are planning to get this done. But so far, so good. Today is day 20 and this is how it's looking. So I started Scar Gel yesterday, so if you see it's like kind of shiny on there, that's why. As of tomorrow, it'll be my 3-week mark, meaning I can start putting eyeshadow on again, which is like crazy how fast this went by. It's not looking as swollen anymore, although it still has some healing to go. The scar is getting so much less noticeable. Why did I say scar? The bruise. Yeah, when I had this like really dark bruise, I was really self-conscious. At this level, I do not feel very self-conscious. So I'm out and about in the world. I'm not wearing like glasses to hide it anymore. And I'm really liking the direction that this is going in. Hello, today is day 27 of my recovery from my upper bleph. Tomorrow is my 4-week mark. So today I'm definitely planning on putting on eyelashes, but before I did that, I wanted to make sure that you guys could see what the progress is like with the eyelashes, or not the eyelashes, eyelids. It's definitely moving along. This bruise disappeared sometime this week, I believe. It's kind of gone. It's mostly gone, like, yeah. So that's not noticeable now. It's just that the swelling and the redness needs to go down. It's honestly like not that bad going out in public anymore. But it's still pretty noticeable. I stopped icing like the entire past week and a half. I probably should have. I also had some nights where I drink wine, so I think that does slow things down, and I stopped taking arnica. So at that point, I think the healing kind of slowed down. However, it's still okay because we're at a point where I can wear makeup, I can do whatever, I can wear lashes, and when I wear the lashes, you can't really tell that the eyes are so crazy. Because the eyes look decent right now, you know? It's gonna keep healing, but I think it's worth noting that this is 1 month of recovery. Hello everyone, so this is 4 weeks of healing after my upper blepharoplasty. A little bit close up. I'm not wearing any eye makeup or anything like that. I actually have like a scar gel on the lids. Bruising has gone down quite a bit. However, there's still some swelling, and it's gonna take a good 6 months to really see the true results because the swelling is going to take time to go down. So far, I'm super happy with it, and I don't feel weird going out in public, even though it is kind of swollen still, but a lot of people really cannot tell. I wanted to end this vlog by going over a few questions that I got on Instagram. These are the questions that I got over and over again, and for those of you who are new here, this is the first surgery that I've ever gotten besides my C-section. The goal with my upper bleph was not to look different, and I also wanted the surgeon to keep my crease at the same level as where it was before surgery. Right now, it's still really puffy, and so we haven't realized the full results yet, but she really didn't take away that much skin. She took away mostly on one side, the other side just a little bit. And so when it settles back down, it'll look very similar to my original eyelids, but evened out because my eyelids were really uneven. And one side was actually hooded way more than the other side. So it brightened up and made me look much more awake and also evened out both the eyelids. Probably the hardest part about pulling the trigger on a surgery like this is that I don't feel that my eyelids were that bad to begin with. And so what a lot of people will say is that I didn't really need this surgery, and I completely get where they're coming from because I didn't really need the surgery. It's more like one of those things that you notice about yourself and it bugs you more on some days and less on other days. But once you notice it, you just can't stop thinking about it. And I realized about myself is that I'm probably going to get this surgery at some point. I might as well get it now and reap the benefits of having the surgery done already. I feel like I look more awake and I feel like I look more focused, and those two things are super important to me. Another question I got was about the actual procedure. Actual surgery was only about an hour long max, but a lot of it is just pre-op. So you have to go in early and they have to take all your vitals and all that and get you ready for surgery. As far as the surgery, I wasn't completely out. They just gave me a shot of Versed and the rest was local anesthesia. And I was out of it. Like, I was like out of it enough where I don't remember a thing. It didn't hurt at all, but I was still awake where if she wanted me to open my eyes or whatever, I could do it. Another question I got a lot was, how painful was it? Again, during the surgery, I didn't feel anything. After surgery, I didn't really feel anything. It looks way more bruised and painful than it actually felt. So of course, if I like touched it, I could feel that it was swollen and there was like some pain with that. But if I didn't touch it, I didn't feel pain. And I only took 2 Tylenols the night of, and the next day I didn't take anything. A lot of people ask me what the total recovery time is. So like I said, I think it's gonna take 6 months for me to fully realize the effect of the surgery. Currently, I'm at 4 weeks. At 10 days is when the sutures come out, and I still had a bruise at that time, but that's when I actually started to see patients. And patients were very okay with the fact that I had purple eye. Then at the 2-week mark, which is 14 days, you can start putting mascara and eyeliner, but nothing on the actual eyelid. At 3 weeks, you can actually start putting eyeshadow and stuff like that on. And my bruise resolved sometime between the 3rd and the 4th week. If you don't want people to know that you had this done and you don't want to risk it, then I would wait at least 2 weeks before going back to work or going out in public. Also, I want to note that a lot of people who had this surgery, where I watched the videos, they did not bruise the way that I bruise. When I bruise for a very long time. It doesn't matter if I'm taking arnica, it doesn't matter if I'm taking bromelain, it doesn't matter. I did all the things and still I bruise. Like, I already know this about me. If you're a fast healer, then you will heal much more quickly than I ever did. Someone asked if insurance covered it. I have heard of insurance covering these, especially if the skin on your eye like really hoods over and it impairs your vision. But for me, it was mostly cosmetic. So no, I didn't have insurance cover it. It was cosmetic in nature. I've actually seen this procedure across the board be very, very different in terms of pricing. The other thing I wanted to mention is that I went to a plastic surgeon, not an oculoplastic surgeon. And I was looking at oculoplastic surgeons. It just didn't match up with my schedule and timing. And so I did hear that oculoplastic surgery is the way to go if you get this type of surgery done, because they're like the experts of the eye area. However, also I felt like the plastic surgery photos looked more like the final cosmetic result that I wanted. And so I went with someone who specifically does a lot of Asian eyes, and that was important to me, and she ended up being a plastic surgeon. I do think that if I had to do like a ptosis repair or something with the muscles around my eye, I probably would have stuck with an oculoplastic surgeon. But I have nothing but good things to say about the plastic surgeon that I went to. She did a great job, and I'm really happy with the result. Also, along those lines, I got questions about eye dryness, because if you guys have been here, you know that I had LASIK years ago before I got Sjogren's. I got Sjogren's earlier this year, and that means I have really dry eyes and really dry mouth. And I told my surgeon that I have Sjogren's, and what she said was that she's going to err on the side of not taking away that much skin, because she wants to make sure that I can close my eyes all the way. So like, if you cut away a lot, then you may not be able to close as much, and that can cause dryness. I have not had any issues with dryness. So that is a good thing. Just make sure you communicate that with your surgeon. I think those are the major questions that I got. If you guys have any questions, leave them down below. Thank you so much for watching, and I hope this was helpful for anyone who's looking into getting the surgery done. Bye.